Welcome to part 2 and last episode of the Herpes Explained All Variants session. Now let's dive into understanding EBV. A common virus, Epstein-Barr Virus, EBV, is a very common virus, and more than 90% of people worldwide have been infected with it at some point. Most people don't even realize they've had it because it often doesn't cause noticeable symptoms. Range of symptoms: asymptomatic to mononucleosis. No symptoms, asymptomatic. Many people who get EBV don't have any symptoms at all, so they never know they were infected. Infectious mononucleosis. In some cases, especially in teens and young adults, EBV can cause a condition called infectious mononucleosis, or mono. This illness causes symptoms like: imagine a teenager who suddenly feels very tired, has a sore throat, swollen glands, and a fever. They visit the doctor and are diagnosed with mono, which is caused by EBV. The teenager might need to rest at home for a few weeks to recover fully. Complications: rare but significant. Although most people recover from mono without any problems, in rare cases EBV can cause more serious issues, like an enlarged spleen or problems with the liver. It's important for doctors to recognize these rare complications so they can treat them quickly and prevent them from becoming more serious. Evaluation and management. Healthcare team role. Imagine a patient with mono is experiencing severe abdominal pain. The doctor might suspect a complication like an enlarged spleen and would order tests to confirm it. The healthcare team, including doctors, nurses, and lab technicians, would work together to monitor the patient and provide the best care, ensuring the patient recovers safely. Severe symptoms and complications in people with weakened immune systems. More severe illness. People with weakened immune systems are at greater risk of developing more serious symptoms and complications from Epstein-Barr Virus, EBV infection. For example, someone with a weakened immune system due to HIV or cancer treatment might experience a more severe form of the illness. Brain, spinal cord, and nerve complications. Neurological effects. EBV can cause several conditions that affect the brain, spinal cord, and nerves. These include viral meningitis, swelling of the tissues that cover the brain and spinal cord and causes pain in the joints and muscle. Encephalitis, swelling of the brain itself. Optic neuritis, swelling of the nerve that connects the eye to the brain, which can affect vision. Transverse myelitis, swelling of the spinal cord, which can lead to paralysis or other neurological issues. Facial nerve palsies, paralysis of facial muscles, such as Bell's palsy, which causes one side of the face to droop. Guillain-Barré syndrome, a rare condition where the immune system attacks the nerves, leading to weakness and paralysis. Acute cerebellar ataxia, sudden lack of coordination in muscle movements. Hemiplegia, paralysis on one side of the body. Sleep disorders, problems with sleeping, which could be linked to brain or nerve involvement. Psychoses, severe mental health conditions that affect how a person thinks and perceives reality. Blood and bone marrow complications. Overproduction of white blood cells. EBV can cause the body to produce too many white blood cells, a condition called lymphocytosis. Immune system weakening. EBV can weaken the immune system, making it harder for the body to fight off other infections. This can lead to neutropenia with secondary infections, low levels of neutrophils, a type of white blood cell, making a person more susceptible to infections. Hemophagocytic syndrome, a severe inflammatory response where the body's immune cells start attacking its own tissues. Acquired hypogammaglobulinemia, a condition where the body doesn't produce enough antibodies, weakening the immune response. X-linked lymphoproliferative disease, a genetic disorder that can cause life-threatening reactions to EBV, particularly in boys. Cancers associated with EBV. Lymphatic system. Cancers, EBV is linked to several types of cancer, particularly those affecting the lymphatic system, such as Burkitt's lymphoma, a fast-growing cancer of the lymphatic system. Nasopharyngeal carcinoma, a cancer that starts in the upper part of the throat behind the nose. Hodgkin's disease and non-Hodgkin's lymphoma, other types of cancer that affect the lymphatic system. Post-transplant lymphoproliferative disorder, an overproduction of white blood cells after an organ transplant. Other tumors, including leiomyosarcomas, cancer in the soft tissues, and T-cell lymphomas. Other complications. Lung and heart problems, EBV can also cause. Pneumonia, inflammation and injury of the lungs. Interstitial lung disease, a group of disorders that lead to scarring of lung tissue. Myocarditis, swelling of the heart muscle. Pancreatitis, inflammation of the pancreas, which can cause severe abdominal pain. Oral cavity issues, EBV can cause oral hairy leukoplakia, which presents as raised white patches on the tongue. This is usually seen in people with HIV. Eye complications. Follicular conjunctivitis, inflammation of the eye's conjunctiva, the thin membrane covering the eye, can occur with EBV infection. This condition, known as follicular conjunctivitis, is also associated with other viral infections like herpes zoster, infectious mononucleosis, and chlamydial infections, as well as reactions to certain topical medications and molluscum contagiosum. Neurological complication, example, a person with a weakened immune system might develop encephalitis due to EBV, leading to symptoms like severe headaches, confusion, and possibly seizures. If not treated promptly, this condition could be life-threatening. Cancer association, example, a person who has had EBV might later develop Burkitt's lymphoma, especially in areas where this cancer is more common. They would need specialized cancer treatment to manage the condition. Lung complication, example, after an EBV infection, someone with a weakened immune system might develop interstitial lung disease, leading to breathing difficulties and requiring long-term treatment to manage lung scarring. Eye complication. Example, a person with EBV infection might experience red, irritated eyes due to follicular conjunctivitis, where the eye's surface becomes inflamed. This condition might be mistaken for a typical eye infection, but in the context of EBV, it's related to the virus's effect on the body. Complications associated with Epstein-Barr Virus EBV. Splenic rupture, dangerous complication. One of the serious complications of EBV, especially in cases of infectious mononucleosis, is splenic rupture. This can occur due to the spleen becoming enlarged and vulnerable during infection. Case study example. In one reported case, a patient experienced a splenic rupture just 6 days after the symptoms of infection began. Treatment options. Conservative management. For patients who are stable, hemodynamically stable, the rupture can sometimes be managed without surgery. This involves careful pain control and close monitoring. Splenic artery embolization. Another non-surgical option is blocking the blood supply to the spleen to control the rupture. Surgical option, splenectomy. If surgery is necessary, the spleen is removed, splenectomy. After surgery, patients need immunizations, antibiotics, and regular follow-ups to prevent infections, as the spleen plays a role in fighting certain bacteria. Airway obstruction. Tonsillar edema, another complication of infectious mononucleosis caused by EBV, is airway obstruction, which can happen when the tonsils and surrounding tissues in the throat, pharyngeal tissues, become swollen. Treatment. This swelling can block the airway, making it difficult to breathe. Treatment options include steroids to reduce the swelling, tracheotomy or intubation, in severe cases creating an opening in the windpipe, tracheotomy, or inserting a breathing tube, intubation, may be necessary. Rarity. Airway obstruction is rare, occurring in about 1 to 3.5% of cases, but it's more common in children. Acute acalculous cholecystitis. Gallbladder inflammation. EBV can sometimes cause a type of gallbladder inflammation called acute acalculous cholecystitis, which occurs without gallstones. Treatment. This can often be managed conservatively with pain relief and antiemetics, medications to prevent nausea. Surgical option. In cases where the pain is unbearable, some patients may choose to have the gallbladder removed through a laparoscopic cholecystectomy, a minimally invasive surgery. Other complications. Heart and nervous system. EBV can lead to several other complications, including myocarditis, inflammation of the heart muscle, encephalitis, inflammation of the brain, hemophagocytic lymphohistiocytosis, a severe immune response where the body's immune cells start attacking its own tissues, pancreatitis, inflammation of the pancreas, autoimmune hemolytic anemia, a condition where the immune system mistakenly destroys red blood cells. Cancer. EBV has also been linked to the development of certain cancers, such as lymphomas, a type of cancer that starts in the lymphatic system, nasopharyngeal cancers, cancer in the upper part of the throat behind the nose, splenic rupture, example, a college student with mononucleosis notices severe abdominal pain a few days after being diagnosed. The doctors discover that their spleen has ruptured. Because they are stable, the doctors decide to manage the rupture conservatively, with pain medication and close monitoring. However, if their condition worsens, they might need surgery to remove the spleen. Airway obstruction. Example, a child with severe tonsillitis from EBV develops difficulty breathing. The swelling in their throat is so severe that the doctors decide to use steroids to reduce the swelling and, if necessary, intubate the child to keep their airway open. Cholecystitis. Example, an adult with EBV experiences sudden severe abdominal pain. After being diagnosed with acute acalculous cholecystitis, they are treated with pain medications and anti-nausea drugs. However, due to the intensity of the pain, they eventually opt for surgery to remove their gallbladder. Cancer example, years after an EBV infection, an individual is diagnosed with Hodgkin's lymphoma, a type of cancer linked to the virus. They receive specialized cancer treatment to manage the disease. Let's take a closer look. Human Herpesvirus 6 and 7. Clinical manifestations, symptoms. Associated illnesses. Exanthum subitum roseola, HHV-6 and HHV-7 are most commonly linked to a childhood illness called roseola, also known as exanthum subitum. Roseola typically causes a sudden high fever, followed by a pinkish-red rash once the fever subsides. Imagine a toddler suddenly develops a high fever, which lasts for a few days. Once the fever breaks, a rash appears on their chest, back, and abdomen. This is a classic presentation of roseola caused by HHV-6 or HHV-7. Kidney transplant rejection. These viruses are also associated with complications in people who have had a kidney transplant, potentially leading to rejection of the transplanted organ. A patient who recently received a kidney transplant might experience organ rejection, and tests show that HHV-6 or HHV-7 could be contributing to this problem. Pathogenesis, how it affects the body. Limited understanding. The exact way these viruses cause disease, pathogenesis, isn't fully understood. Researchers are still studying how HHV-6 and HHV-7 contribute to the illnesses they are associated with. Epidemiology, how common it is. Widespread infection. By the time children reach the age of 5, almost everyone has been exposed to and has developed antibodies against HHV-6 and HHV-7. This means the vast majority of people have encountered these viruses early in life. Most young children, even if they don't show symptoms, will have been exposed to HHV-6 and HHV-7, which is why nearly everyone has antibodies against these viruses by the time they start school. Now let's delve into Human Herpesvirus. 8. Clinical manifestations, symptoms. Associated illnesses. Kaposi's sarcoma. HHV-8 is most commonly associated with Kaposi's sarcoma, a type of cancer that forms in the lining of blood and lymph vessels. This cancer is particularly seen in patients with AIDS, where it causes dark purplish lesions on the skin and other parts of the body. An AIDS patient might notice dark purple spots on their skin. Upon examination, doctors diagnose them with Kaposi's sarcoma, a cancer linked to HHV-8. Intra-abdominal solid tumors. HHV-8 has also been found in association with certain types of tumors that occur inside the abdomen, though this is less well known. Pathogenesis and epidemiology, how it affects the body and how common it is. Limited understanding. Very little is currently known about how HHV-8 causes disease, pathogenesis, or how it spreads in the population, epidemiology. Since this virus was only recently discovered, researchers are still trying to learn more about its behavior and impact. Imagine scientists have discovered a new species of bird in a remote jungle. They know it exists, but they still don't know much about its habits, diet, or how it interacts with its environment. Similarly, with HHV-8, we know it's linked to certain cancers, but there's still much to learn about how it works and spreads. Finally, I will explain the classification. Grouping of herpes viruses. Purpose: the classification of herpes viruses into different subfamilies helps scientists understand how these viruses are related to each other through evolution. It also highlights the unique characteristics of each group. Alpha herpes viruses. Characteristics: fast reproduction. These viruses have a very short reproductive cycle, meaning they can replicate quickly within hours. Destruction of host cells. They rapidly destroy the cells they infect. Wide host range. They can infect a variety of tissues within the host. Latent infection in nerves. After the initial infection, these viruses hide in the sensory nerve ganglia and can reactivate later. Members. This group includes herpes simplex virus types 1 and 2, which cause cold sores and genital herpes, and varicella zoster virus, which causes chickenpox and shingles. Imagine a virus that enters your body, quickly makes copies of itself, and then hides in your nerves, only to resurface years later as shingles. Beta herpes viruses. Characteristics: restricted host range. These viruses infect a more limited range of tissues compared to alpha herpes viruses. Slow reproduction. Their reproductive cycle is much longer, taking days to complete. Enlarged cells. A unique feature of these viruses is that they cause infected cells to become enlarged. This is seen in infections like cytomegalovirus. Latent infection in glands and kidneys. These viruses tend to hide in secretory glands, cells of the immune system, reticuloendothelial system, and kidneys. Think of a virus that slowly reproduces and causes the cells it infects to swell up. It hides in places like your glands and kidneys, staying dormant until it reactivates. Gamma herpesviruses. Characteristics. Very limited host range. These viruses have the most restricted range of tissues they can infect. Replication in lymphoid cells. They typically replicate in lymphoblastoid cells, which are immature white blood cells, and can cause lytic, destructive infections in specific targeted cells. Latent infection in lymphoid tissue. These viruses often remain dormant in the lymphoid tissues, which are part of the immune system. Members, Epstein-Barr Virus, EBV, which can cause mononucleosis, is a well-known member of this group. Kaposi's sarcoma herpes virus, linked to certain cancers in AIDS patients, is closely related to EBV. Human herpes virus 6 and 7 are also considered part of this group, though their classification is still under study because they share some characteristics with beta herpes viruses EBV, which can cause mononucleosis and is linked to certain cancers, fits into this category. Thank you for watching this detailed exploration of human herpes viruses. If you found this video informative, don't forget to like, share, and subscribe for more insights into the world of viruses and human health. See you in the next video.